Question number 1. Which of the following is considered the fifth vital sign? The right answer is option B, pain level. Question number 2. The normal range for adult resting heart rate is. The right answer is option D, 60 to 100 beats per minute. Question number 3. When assessing a patient's blood pressure, the throat cough sound represent. The right answer is option B, blood flow through the artery. Question number 4. The most effective method of preventing the spread of infection is. The right answer is option B, hand hygiene. Question number 5. The chain of infection includes all of the following except. The right answer is option C, immune system. Question number 6. Which type of isolation is used for patients with airborne infectious diseases? The right answer is option A, airborne precautions. Question number 7. The 5 rights of medication administration do not include. The right answer is option D, right insurance coverage. Question number 8. When calculating IV drip rates, which of the following is typically used? The right answer is option B, drops per minute. Question number 9. A patient is prescribed 500 mg of an antibiotic every 8 hours. How many doses would they receive in 24 hours? The right answer is option C, 3 doses. Question number 10. The most important aspect of obtaining informed consent is. The right answer is option B, patient's understanding of the procedure. Question number 11. When communicating with a patient who has hearing impairment, the nurse should. The right answer is option D, face the patient and speak clearly. Question number 12. Which communication technique is most effective when dealing with an anxious patient? The right answer is option C, active listening. Question number 13. The primary characteristic of type 2 diabetes is. The right answer is option A, insulin resistance. Question number 14. Which condition is characterized by a chronic inflammatory response in the airways? The right answer is option C, asthma. Question number 15. The most common early sign of shock is. The right answer is option D, increased heart rate. Question number 16. In cardiopulmonary resuscitation, the current recommended chest compression rate is. The right answer is option C, 100 to 120 compressions per minute. Question number 17. The first step in the primary survey is. The right answer is option D, airway. Question number 18. Signs of respiratory distress include all except. The right answer is option A, normal oxygen saturation. Question number 19. The most critical factor in wound healing is. The right answer is option D, proper nutrition. Question number 20. Stage 4 pressure ulcers are characterized by. The right answer is option A, full thickness tissue loss. Question number 21. Patient advocacy primarily means. The right answer is option A, protecting the patient's rights. Question number 22. The principle of patient autonomy means. The right answer is option B. Patients have the right to make informed decisions. Question number 23. Which medication route provides the fastest absorption? The right answer is option D. Intravenous. Question number 24. A therapeutic range of a medication refers to. The right answer is option B. The dose that provides maximum benefit with minimal side effect. Question number 25. When measuring an infant's temperature, the most accurate method is. The right answer is option A. Rectal. Question number 26. The most significant concern for elderly patients is. The right answer is option C. Risk of falls. Question number 27. The recommended daily fluid intake for an average adult is. The right answer is option D. 2 to 3 liters. Question number 28. Enteral nutrition is administered. The right answer is option B. Directly into the stomach or intestine. Question number 29. The CASH questionnaire is used to screen for. The right answer is option C. Alcohol abuse. Question number 30. When assessing a patient's mental status, the nurse should evaluate. The right answer is option B. Appearance, behavior, cognitive function.